Good afternoon. This is Rosie Bartel, and I am going to give you the patient's perspective on portals. First of all, my reason for being so interested in portals is because at this point I have 7 portals. And of those 7 portals, I use one all the time, and the other 6 I use to get test results. And this is why. First of all, my story began 10 years ago in 2009 when I had a knee replacement that turned into a MRSA staph infection that led to 55 surgeries, over 200 hospitalizations. Um, I went into septic shock more than 12 times. I have had an amputation of my leg above my knee, then the amputation of my hip, and then part of my pelvic bone. Because of this, I've had multiple hospitalizations because of multiple doctors, because of multiple um, things happening to me. I had to look to my portal as being a help, but many times it wasn't a help. It was more of a hindrance because it made me frustrated. I can tell you that um, a portal can only be helpful if it is a good for everyone. Because of this, I got very involved with a group that John mentioned in the beginning. It's the National IT Patient and Family Advisory Board, and this board um, is looked at the portal from the patient's point of view. Next slide. A portal by a patient to inform collaboratively with healthcare to improve the portals for all. That was our objective. We called it the P3 project, Perfect Patient Portal. And in this project, we looked at data from surveys. We had 60 responses to a survey. 41 of them were from Epic, 13 were from Cerna, one was a homegrown, and 21 we didn't know where they came from. We could identify health organizations, but not where they came from. Next slide. This project that we did, this survey told us that the things that were most desirable was number 1, communication, number 2, test results and lab results, and number 3, appointments. For me, I'm going to tell you that test results are important. Appointment setting and being able to do it is important, and to set up my appointments is important. But communication is key. I can tell you that at times I've had doctors disagree with treatment, and I was the go-between between doctors. And I'm going to tell you the only time that I've ever been able to handle that well is when I had my open notes. In the portal where I have open notes, I can take the note from one doctor and take it to the next doctor and say, this is what I heard, this is what he said, here it is in black and white. Because when a patient is caught between 2 doctors, and one is saying do this and one is saying do that, you don't know which way to go. You are living with 2 doctors living in their silos, and you are caught in that walkway between the silos. And the only way you can cross that walkway is be able to communicate. And you can't communicate if you don't have notes. And I'm going to tell you, the open notes was my saving grace in those communication situations. And yet it was also my downfall when I didn't have notes. I literally changed hospitals and physicians at one point because I couldn't get from one silo to the other. And when you're sick, the last thing you need in this world is to have 2 doctors that won't communicate with each other, and you are the person caught in the middle. So yeah, I'm going to tell you, communication is the most desirable feature. Next slide. But the least desirable can also be communication, because when your portal doesn't provide the things you need to communicate to the next person or to communicate with others, or you can't get the information you need through your portal, you then become very frustrated. So I'm going to tell you, if that silo that was operating between these 2 doctors, because I didn't have a portal, I couldn't communicate. Technology is another whole piece that is very frustrating for patients. They, when the technology is impossible to use, it's impossible for them to pass, to be able to get from one point to the next point to the next point. And interoperability, when you can't use that technology between your home computer and your handheld um, mobile device. Basically, for me, I only use iPads and iPhones because of laptops don't work well for me, and sitting for long hours in front of a computer in a wheelchair is hard for me. So being able to use my iPad and my mobile phone to to get to my portal is so important to me. Next slide. So basically, one of the things that our P3 this came up with is a perfect patient portal would be centered about me. It's not about what is good for only for healthcare providers, but it's what is good for for care providers partnered with experience for patient and family. It's from bedside to boardroom. It's from that patient-centered care is in a partnership in the design, the program, and individual plans for providing the best outcomes for their patients. And as you look at measurement and patient related outcomes, and how you measure them, you have to be looking at how these portals really look at how it will improve patient care and how it will improve patient outcomes. And I'm going to tell you, I'm a better patient when I have good information. Next slide. Accessibility. As you can see, I want the concept of accessibility is it needs to be accessible to everyone, every which way, and every way they can. It cannot just be connected to computers, but not mobile devices. Next slide. Also, the concept of the landing page. That landing page has to have everything you need and everything you want at your fingertips. It has to be easy to find, easy to connect with, easy to locate. I'm going to tell you my favorite portal. I can make an appointment. I can check in for my appointment. I can update my um, meds on that appointment for that appointment. I can update my insurance cards for that appointment. I can do everything for that appointment long before I walk into the door. So when I get to the doctor has all those things updated. I don't have to fool around with paperwork and things when I get to the doctor. I can only deal with things that really matter to me. And that is those things that are mattering to me on that day, not those things that are important and behind the scenes. Next slide. The concept of the personal profile. You need to know about me. You need to know more than just my name and my meds and what's wrong with me, but you need to know what matters to me. What is the activity level that's important to me? What are my health goals? Um, what are my concerns that day? And that, a portal needs to be able to give you that information so that when I walk in the door, it's you're ready for me. The other piece is that personal information needs to know who is also part of that picture, who else is part of my portal. Next slide. Then communication. I'm going to tell you that one of the big uses that I got in communication from my portal that I love is that it was not only communication from them, but I also could communicate. If you ever look at my husband's phone and my portal, you will find tons of pictures of a wound that I was healing. And because I didn't want to go drive 2 hours every time I had a concern about the wound, I would take a picture of the wound. I would write a scenario of what I was concerned about, and I would send it through my portal. And I can tell you that because of this portal and because of how well it was managed, I would get an answer back within an hour of should I come to the doctor and have it looked at further, or should I add something to my wound care at home? Or I got an answer. I didn't have to wait. So the communication can not only be one way. Yes, I want my open notes. I want everything about me in that portal. But I also want to be able to ask questions about it. I want to be able to communicate with my physicians, and I want to be able to get answers. Next slide, please. Then it needs to be able to help me. It needs to be able to give me help for the portal. I heard that Emery talk about that highly, that is so important to give that technical support. You need to be able to give patient support. I just gave you a story about that. The support of how I can better get better deal with my wound. And then education. And I know that, so many times we go to the internet and maybe not the best internet to get information. I would love to go to my portal and get the best information, the best education about what I'm concerned about. And it may not be the same thing every day. So don't hand me a piece of paper about my wound and that's you think is the only thing I'm concerned about, or about MRSA and you think that's the only thing I'm concerned about. Patient education piece should be able to get information about all the things that might matter to me on any given day. Next slide. I want to thank you for hearing my story, hearing why portals are so important to me and to other patients. I believe portals there's a lot of work being done by the companies who develop portals and by hospitals that use them, but I think you still need to keep hearing the patient's voice and make sure that the patient's voice is involved. I am involved at this point with one of the providers of portals. I'm on their um, advisory board, and it's been a real eye opener about how much they don't know about patients. Thank you again for hearing my story.